Hello everyone, I'm Laura, and in today's video, we will be discussing the 6 main reasons behind a reduction in ejaculatory volume or semen volume. This is a very common complaint in urology clinics. Many men come in concerned after noticing a decrease in the amount of semen they ejaculate. This issue can be associated with several different causes, and today we are going to cover 6 of them. But before we dive into the causes, let's first understand what is considered a normal ejaculatory volume. On average, a man releases between 2 to 5 milliliters of seminal fluid with each ejaculation. This amount can vary depending on age and the patient's functional status. There are 3 main mechanisms responsible for the reduction in volume, which are associated with the causes we will soon discuss. The first mechanism is a decrease in production. Semen production involves the prostate, seminal vesicles, bulbourethral glands, and the testes. Over time, with aging, it is normal for this production to decline. So, the first mechanism is a decrease in the production of seminal fluid. The second mechanism leading to reduced ejaculation volume is retrograde ejaculation, which is defined as semen flowing backward into the bladder instead of following its normal, forward path to be expelled through the penis. We will later go over the various causes of retrograde ejaculation. However, it is important to reassure patients that this condition typically does not cause any harm or damage. The semen simply travels back into the bladder and is subsequently eliminated during urination. The main situation in which retrograde ejaculation becomes a concern is when a patient is trying to conceive naturally, as it can make achieving pregnancy more difficult. The third mechanism is obstruction of the ejaculatory duct. In this case, semen is produced, but due to a blockage, it is prevented from being expelled. Now let's move on to the causes. The first cause is related to aging. As we mentioned earlier, the production of seminal fluid naturally declines with age. The second cause is increased sexual frequency or excessive masturbation. This is fairly easy to understand. The more frequently a patient engages in sexual activity or masturbation, the more it is expected that semen volume will decrease. If the patient refrains from ejaculation for a longer period, the ejaculatory volume tends to be higher. The third cause is medication-related. Here, we have several drugs that can alter the mechanics of ejaculation. First, medications used to treat benign prostatic hyperplasia, BPH, specifically alpha blockers such as tamsulosin and doxazosin, which often lead to retrograde ejaculation. This is a very common side effect reported by patients using these medications. The second group of medications includes those that reduce the size of the prostate, also used in the treatment of BPH, such as finasteride and dutasteride. These drugs decrease the production of seminal fluid. Another class of medications we can mention are antiandrogens, which block testosterone, thereby reducing sperm volume, as well as some chemotherapeutic agents and certain antidepressants. Now, speaking of natural solutions. If you feel that your performance or your semen volume isn't what it used to be, and you want to take action in a 100% safe and natural way, there's a quick method you can try today. It's a simple 7-second home trick that helps restore male vitality and semen production completely naturally, without the need for medications or procedures. I'll leave the QR code here on the screen. Just point your phone's camera at it, and I'll also pin the link in the comments section. Check it out later and see how this solution can make a difference for you. Now, continuing on. In addition to medications, another very common factor that can affect ejaculatory volume is surgery. For example, prostatectomy procedures, typically performed in prostate cancer treatment. Radical prostatectomy involves the removal of the prostate gland and the seminal vesicles. As a result, the patient will no longer ejaculate. However, this does not affect orgasm. A patient may still achieve an erection and experience orgasm, but there will be no ejaculatory fluid. Another type of surgery that can affect ejaculation is transurethral resection of the prostate, TURP, commonly referred to as prostate scraping. After this procedure, it is common for patients to experience retrograde ejaculation, that is, semen flowing backward into the bladder. Other surgeries that can impact ejaculation include rectal surgeries and retroperitoneal surgeries, which can lead to nerve damage and result in anejaculation. A very common question from patients regarding surgical procedures is whether vasectomy causes a reduction in ejaculatory volume. Let me clarify. Vasectomy involves cutting and sealing the vas deferens from the testicles. The testicles mainly produce sperm cells, which contribute only a very small portion to the total semen volume. Therefore, vasectomy essentially does not affect the overall volume of ejaculate. The fifth cause, which is very common, is diabetes. Diabetes can lead to diabetic neuropathy, resulting in nerve damage that inhibits the ejaculatory reflex in some patients. The sixth and final cause is spinal cord injury. Depending on the level of the spinal injury, the ejaculation reflex may be impaired, and the patient may lose the ability to ejaculate. If you found this information helpful, please share it with someone who might benefit from it. Leave a like so YouTube knows it's a valuable video and helps it reach more people. Don't forget to subscribe to the channel and turn on notifications so you won't miss any of the new videos. Take care and see you next time.